Welcome, everybody. We will be discussing Section 5 of the Plan Preprint, which covers providing stable childcare and financial assistance to families. And as noted in the upper right-hand corner, this section is for tribal lead agencies with medium or large allocation sizes. So we wanted to introduce ourselves as we will be your presenters for today's training. We'll go ahead and start with Dee. I'll pass it over to you.
Thank you, Nazba. Good afternoon or good morning. My name is Dolores Frala. I too am representing out of the Tribal Childcare Capacity Building Center as a subject matter expert around construction major renovation. Teresa?
Thank you, Dee. My name is Teresa Campbell, and I am the Training and Resource Development Specialist with the Tribal Child Care Capacity Building Center. And I will now pass it back to our colleague, Nazba.
All right. Thank you, Teresa and Dee. My name is Nazba Hill. So Yate and Sagoli, greet you in my native languages. I come from the Navajo and Oneida Nations, and I am the Tribal Subject Matter Expert for Subsidy Administration with the Tribal Child Care Capacity Building Center. So as we move forward with today's session, please feel free to unmute or stop us if you have questions, or type your questions in the chat box. The chat box can be found on the lower right-hand side of the Zoom screen. And we want to remind you that this is a safe space to ask all of your questions. So please feel comfortable to ask any questions, or if you need clarification on anything we cover. So as we wait for everyone to join, we invite you to introduce yourself in the chat box, which can be found on the lower right-hand part of the Zoom window. Please let us know who is joining us today. So today's objectives are to compare standard and categorical eligibility to identify appropriate eligibility criteria, describe the application and eligibility determination and redetermination process, explore ways to improve access for vulnerable children and families, analyze and determine family contributions to payments. Section 5 covers the following topics: 5.1, eligible children and families. 5.2, application and eligibility determination redetermination process. 5.3, improving access for vulnerable children and families. And 5.4, family contributions to payments. So let's begin with section 5.1, eligible children and families. Tribal lead agencies with medium and large allocation sizes must include the basis for determining family eligibility through one of two options: standard eligibility or categorical eligibility, or a combination of both. For example, a tribal consortium could use categorical eligibility in rural villages and standard eligibility within a more populated area. So in the next few slides, we'll examine each option. Tribal lead agencies whose tribal median income exceeds 85% of the state median income must use standard eligibility. If the tribal median income is below 85% of the state median income, then you can choose either standard or categorical eligibility. Tribal lead agencies that are required to or choose standard eligibility must meet the eligibility criteria established by the final rule. When eligibility is determined, children must meet the following criteria: your definition of Indian child, reside within your service area, be under the age of 13 unless the grantee chooses to serve children between the ages of 13 and 19 who meet the grantee's definition of physically or mentally incapable of self-care or under court supervision. Reside with a family whose income does not exceed 85% of the grantee median income, which can be either the tribal median income or the state median income for a family of the same size. Reside with a family whose assets do not exceed $1 million, and either reside with a parent or parents who are working or attending a job training or educational program or receiving or need protective services. If the tribal median income, often referred to as TMI, is below 85% of the state median income, or as we refer to SMI, you may choose the categorical eligibility option where any child that meets your definition of an Indian child and who lives in the service area could be considered eligible to receive services regardless of the family's income, work, or training status. It's important to note that categorical eligibility applies to tribes with medium and large allocation sizes, while tribes with small allocation sizes have the added flexibility of defining their own eligibility requirements. If tribes choose to take advantage of the categorical eligibility option, they can create opportunities to align CCDF programs with other tribal early childhood programs, including tribal home visiting, early Head Start, and Head Start. So for example, if a tribe operates a Head Start program for part of the day, it could consider all Head Start students to be categorical eligibility and use CCDF funds to operate a full day streamlined Head Start and CCDF classroom. Tribal lead agencies that opt to use categorical eligibility must still meet all other CCDF requirements around stable financial assistance and equal access, including family contribution to payments. You'll still need to collect income to identify co-payments on your sliding fee scale. Be sure to consider how your current CCDF funding, CCDF funding level. How will different eligibility options impact your availability, your available funds for direct services? Your CCDF available funds for direct services, your funding level stays the same no matter which eligibility type you choose, categorical or standard. So be sure to consider the impact of having more children who might be eligible for services and funds that you have. Be sure that you choose the option that makes the most sense for your tribal community and service area. Tribal lead agencies that choose to implement categorical eligibility will have to show a comparison of TMI and SMI by family size in their CCDF plan and cite their data source. Tribal grantees can use the census data. However, they have the flexibility to determine their own data source. If you choose to use the census data to locate your tribal median income, you can visit the United States Census My Tribal Area website to locate your tribal median income. You may use your state's median income chart to locate your state's median income level, and you can access the state median income and federal poverty guidelines resources for your state on the Plan Preprint virtual training homepage, and we will drop the link to the charts for you in the chat. So use the information to compare the two. If the tribe's income at 100% for a family of 4 is less than 85% of the state median income, for a family of 4, your tribal lead agency is eligible to select categorical eligibility in your tribal CCDF plan. If you need assistance in gathering this information, please join the writing cafes or request technical assistance from your regional office. If you choose to implement categorical eligibility for the first time in your fiscal year 2023 through 2025 tribal CCDF plan, or through a plan amendment, you will want to consider how this will affect your current policies, procedures, and processes. So you may want to consider using the policies and procedures checklist for childcare and developmental fund tribal lead agencies checklist 5, table 1A on pages 36 through 37 to review and update your current subsidy policies and procedures to ensure that you meet the final rule requirements. And so we will drop the link in the chat box to this resource as well. You also will want to update your sliding fee scale to base it on the tribal median income instead of the state's median income, and training CCDF staff on the new eligibility criteria, required documents to collect from families, and wait list processes. If your tribal median income is lower than 85% of your state median income and you are considered choosing categorical eligibility in your plan, you may want to review this resource called Implementing Categorical Eligibility, Tips and Considerations for Tribal Lead Agencies with Medium and Large Allocation Sizes. And we'll drop that link in the chat box. And this is a really awesome resource to review if you are considering choosing categorical eligibility. So I would also like to you to think about these questions. If you are considering categorical eligibility, you might want to think about what are the benefits of categorical eligibility for my community? Why should I choose this option? How would you prioritize children with the highest need if you choose categorical eligibility? Will you utilize any optional eligibility requirements and add them to your plan? Will you need a wait list, or will you need to freeze enrollment when you reach your maximum number of eligible families, or do you have policies and procedures in place to maintain a wait list? And how will you notify families if once froze enrollment and now are ready to open it back up? So we'll just pause here for any questions. I'm just going to look at the chat really quick and
I have a question.
sure.
Can you elaborate on where you said CCDF funds regardless of family income, work, or training status? Well, can you go into that more? I didn't understand that.
So if you choose categorical eligibility, you have to make sure that your tribal median income is at 100% is less than your state median income at 85%. If it is, then you can choose categorical eligibility. If you choose categorical eligibility, you do not have to use those eligibility criteria. So working, income, the job training requirements that standard eligibility requires, those are optional. You can still use them, but you have the choice not to use them. So if you don't want to use income, like you just want to say that everybody in your service area is eligible to receive services regardless of their income level, you can do that. You would still have to collect their income though, because parents are still responsible for a co-payment, which we will get into more into this presentation. So hopefully that answers your question.
I have a question.
Yes.
Okay, so you said any Indian child in the reservation area. And so if you choose categorical eligibility for your program and you historically have only provided services for your own tribal citizens, then so that would need to be changed, and you would have to have that requirement to provide services to any Indian child. So you would have to change the definition.
So categorical eligibility, you still would follow the criteria that you defined for your definition of Indian child. So you could choose to serve, if you chose categorical eligibility, let's say for your entire service area, as long as the child meets your definition of Indian child, you could serve them regardless of their family's income if you choose to not use income as eligibility criteria, if that makes sense.
Yeah.
You're still going to follow your definition of Indian child, however you defined it.
Okay, so that's how we define it. We only provide services for our own citizens and then their descendants. And so I wouldn't have to change my definition. I would go by the definition that I have. The only thing that would change would be the income, then providing all that stuff you said about income eligibilities and stuff.
Yeah, you choose, so you have the flexibility to choose your eligibility criteria. So with standard eligibility, the parents have to be in an activity, right? They have to be working, they have to be in job training, or maybe participating in the educational component. But with categorical eligibility, you have the flexibility to define your eligibility criteria. You don't have to have those as your eligibility criteria if you don't want to. And then if you feel like you want to meet the more children outside of that, if you want to serve all federally recognized children, and that would you would have to talk to your regional program specialist about your definition of Indian child and if you can amend that. But for the purposes of the categorical eligibility, you just want to make sure that all the children that you're serving meet the definition of your Indian child.
Okay, thank you.
You're welcome. All right, well, let's move on. We'll have plenty of opportunity for more questions as we proceed. So all tribal lead agencies must determine the age range that the tribal CCDF program will serve no matter which type of eligibility they select. Eligible children who reach the maximum age within the 12-month eligibility period shall continue to receive CCDF services until their current 12-month eligibility expires. In this section of the plan, you will insert the minimum and maximum ages served, not to exceed age 13. If you plan to serve older children, you will enter the information in the next 2 questions of the plan. In this section, you will need to consider whether tribal lead agencies will allow CCDF funded childcare for children ages 13 and older, but below age 19 who are physically and or mentally incapable of self-care. You will also need to define what upper age is and define what is meant by physical or mental incapacity. Similarly to children incapable of self-care, you will need to consider whether your tribal lead agency allows CCDF funded childcare for children ages 13 and older, but below age 19 who are under court supervision. If you do allow CCDF funded childcare for children who meet this criteria, you'll need to specify what the upper age is. CCDF eligibility requirements also include criteria around whom the child resides. The final rule specifies that a child must reside with parents, legal guardians, foster parents, or individuals acting in loco parentis. In the plan, you will define residing with. In the final rule, in loco parentis means in the place of a parent and refers to an individual who assumes parental status and responsibilities for a child, such as a foster parent or other guardian. Tribal lead agencies are asked to provide their definition of in loco parentis in their tribal CCDF plans. Definitions of in loco parentis often include forms of formal or informal guardianship of the child needing services. So in 5.1.2.1, the tribal lead agency will identify if they will be implementing categorical eligibility. Tribal lead agencies may also use a hybrid approach to determining eligibility, and that is a combination of standard and categorical eligibility. So for example, tribal lead agencies may choose to use standard eligibility and categorical eligibility in different parts of their service area, or a tribal consortium may establish different eligibility tracks based on the preferences and its participating tribes. Your option to choose from in the plan are no, to indicate you will not be choosing categorical eligibility, and then CARS will move you directly to section 5.1.3, which you will fill out. Or you could choose yes, the tribal lead agency implements categorical eligibility for the entire service area. If yes, you will then complete sections 5.1.2, and CARS will move you directly to section 5.2. You will skip sections 5.1.3 through and including 5.1.6. And the final choice is you can also have the option to choose yes, the tribal lead agency implements categorical eligibility for part of the service area or for a tribal consortium for one or more participating tribes. If yes, fill out 5.1.2 through and including 5.1.6. To demonstrate that the tribal median income or TMI is below 85% of the state median income or SMI, you will use data from a reliable source such as the U.S. Census, Federal Department of Housing and Urban Development, also known as HUD data, or another option chosen by the tribal lead agency. And so you will use this data for a family of 4, and you will compare the TMI data to the SMI for your state for a family of 4. To make it easier to find your state's data, we posted the state median income and federal poverty guideline resources on the Plan Preprint virtual homepage. And so we'll share this link to access your state charts again in the chat. So for question 5.1.2.2, you will input the monthly median income for 100% of the state median's income, 85% of the state's median income, and 100% of the tribal median income. Remember that 100% of the tribal median income must be less than 85% of the state median income for you to choose the categorical eligibility option. In question 5.1.2.3, tribal lead agencies will document the data sources used to determine the tribal median income and the state median income. You will complete the date the information was gathered, the attachment number of the documentation, the web address found, and the state used for the SMI. Tribal lead agencies that implement categorical eligibility can choose to establish additional eligibility criteria based on other factors, such as income or family's work, education, or training status, provided that these criteria are defined in the Tribal CCDF plan in section 5.2.4. For example, you could choose to deem all Indian children within the service area eligible regardless of parental income, but still require that parents be working or enrolled in a job training program. And so when we say all Indian children, remember that they have to meet your definition of Indian child. If you choose categorical eligibility, you may consider implementing some of the eligibility criteria used in standard eligibility as a method of prioritization. If you are using a hybrid approach to determining eligibility, that is a combination of standard and categorical eligibility, you will add information to describe this approach as well in section 5.1.2.4. Tribal lead agencies that choose to exercise this option must ensure that children with the highest need are prioritized for services. This includes the following groups: children who meet your definition of protective services, children who meet your definition of special needs, and children experiencing homelessness. Your tribal lead agency could consider developing a point system to prioritize children for subsidy eligibility. Points could be given to children of a certain age, like infants and toddlers, or children who are in one of the groups that I just mentioned. Develop written policies and procedures with prioritization for services based on the child's needs or situation. And you will describe your process within this section of the plan. If you had chosen categorical eligibility for the entire service area, CARS will move you directly to section 5.2 to continue completing your plan. And now I am going to turn it over to Dee.
Awesome. All right, I get to take you all into seeing what your thoughts are. So with that being said, we want to kind of transition over to an idea board, and that information will be dropped in the chat box for you all to transition over to the idea board. So in this activity, we want to hear your ideas around benefits and challenges of standard or categorical eligibility. If you can, as soon as you get into the idea board, what you'll do is you'll click on the green plus there, and when you click it, sticky note will appear, and then just let us know what you feel around the benefits of standard eligibility, the benefits of categorical eligibility. Those types of responses is what we're looking for. So benefits and challenges. There may even be a few of you that have not done categorical eligibility, but could see what, information around what those challenges are for you now, thinking about whether you're going to choose categorical. So I'll give you guys a few minutes to see what you have in thought and in mind. We've just went over the two choices that you might have, whether it's standard or categorical eligibility. Right, I'm reading off of what we're getting so far. We have benefits of standard eligibility. Challenge of standard eligibility is we can serve more families, especially those that are just over 85% of the income by a few dollars, right? The challenges for categorical would be budgeting. If I open services to the entire service area, and we hear that a lot, of what would that projection be like if we did have categorical eligibility? Will the funding be available? Will the budget cover those type of things? Another one up here for challenges on standard is offering more families childcare instead of sending money back for direct services. Absolutely. And again, that piece around projection of how far your money can stretch, how far does your budget look like in regards to how many more children can our standard eligibility cover? Another here under the same category is, can we choose or can choose and ensure services to certain populations like all children in early Head Start? Absolutely. However, you guys have your eligibility or your standard eligibility written out. Let's go over here on this other side. We have benefits of categorical eligibility, increase in direct services to more children. Absolutely, that is the ideal thought around that, especially for those that are, there's some areas in a lot of our reservations, unique areas that we cannot serve children. And I think that also plays a role in this as well for the increase of direct services to more children for those types of areas or the challenging areas that we have where we're trying to reach children for eligibility. Let's go down here to challenges. I think I may have already mentioned that is the budgeting portion. All right, we're so glad you all were able to, this idea board will still be up. Oh, hey, we got more. Benefits of standard eligibility. Absolutely. I think a majority of our group here probably does do standard eligibility that ensures all families who are low income are getting services, as well as funding for families in most financial need. Absolutely. Benefits for categorical is to help stabilize care for children in our tribal community, as well as meeting the needs of families that are barely over 85 or even by those few dollars. Absolutely. Up here, let's just mention this one that just came in, the challenges of standard eligibility. Some families are over income, but gas and food expenses are going up, so we can help these families and with childcare assistance in categorical assistance in categorical. On the bottom is the challenge for categorical would be having enough providers to meet the need. Absolutely. That also has been mentioned to us. And in person around meeting the need of the children. Is there enough providers? Is there enough space? Right. All right. Well, again, thank you, everyone. The idea board will still be open if you feel like you would like to still add to our getting our ideas around the challenges and benefits of standard or categorical eligibility. Thank you, everyone, for participating. We really appreciate that. That's really helpful. So let's talk a little bit on 5.1.3.1, the definition of work, job training, and education. We'll cover information related to standard eligibility. Those of you who have chosen categorical eligibility, only CARS will skip this section. To be eligible to receive CCDF services, children must reside with a parent or parent who are working or attending a job training or an education program, or are engaged in a job search activity and or must receive or need to receive protective services. So tribal lead agencies have broad flexibility in defining working, attending a job training program, and attending an educational program. The definitions of providing should include any allowable activities, including travel time and study time. For example, a definition of working could include working for a salary or wage, self-employment, drug or alcohol rehabilitation, subsistence activities, job search, and or volunteering, as well as travel time to and from the activity. Definitions should also address any limitations such as a minimum hours worked, minimum hours required, or maximum hours allowed. Parents must work or participate in education or training activities to be eligible for child care subsidy, except for temporary interruptions. Tribal lead agencies can do this when defining policies and procedures that consider how retention of eligibility during periods of family instability, such as losing a job, can alleviate some of the stress on the families, facilitate a smoother transition back into the workforce, and support children's development of maintaining continuity in their child care. So for section 5.1.3.1, you will define working, job training, and education. In addition to defining job training and education, you'll need to include your tribal lead agency's definition of attending job training or an education program. So lead agencies have flexibility in defining this, for example, and you could include time and travel as part of attendance. Here we'd like to talk a little bit about examples of definition. Definition of working, job training, education, and attending job training or education to illustrate the broad range that tribal lead agencies have written in making these decisions. So work activities could include paid employment, and it may be subsidized, work search, job readiness activities, community work experience, and job sampling and approved substance activities. There is no federal threshold for the minimum number of hours a parent must be engaged in a work or education activity. So be sure that your definition addresses any limitation as minimum hours required or maximum hours allowed. So let's just pause really quick here to see if anybody has any questions. And if not, we also have the chat box that you could drop questions in. All right, I don't see any. We'll just move over to protective services. Lead agencies may provide services to children who are residing with a family that is receiving or is in need of receiving protective services, which may also include certain vulnerable populations as defined by the grantee. Children receiving or in need of receiving protective services may be eligible even if parents do not otherwise meet work or activity requirements. If the tribal lead agency provides CCDF funded childcare to children in foster care who foster care parents are not working or in education or maybe training activities, these children are considered to be in protective services and must be included in this definition for CCDF purposes. So here in section 5.1.4.1, lead agencies will indicate if they include children who receive or need to receive protective services. If no, CARS will move them to the 5.1.5, and if yes, you will need to complete the questions. So definitions of protective services. Are children in foster care considered to be in protective services? Does the tribal lead agency waive income eligibility requirements for cases in which children receive or need to receive protective services on a case-to-case basis? Does the tribal lead agency provide respite care to custodial parents of children in protective services? Does lead agencies waive the asset limit on case-by-case basis for families defined as receiving or in need of protective services? So examples of protective services descriptions include children receiving protective services through appropriate agencies in foster care, whether that's in state or tribal, or in kinship care, in crisis situations due to domestic violence or homelessness, with disability or physical, mental, or medical condition, or have a disability, whether that's physical, mental, or medical condition, unable to care for the child due to addiction to controlled substance or attending an inpatient or outpatient drug or alcohol rehabilitation. Tribal lead agencies have the flexibility to define protective services beyond the formal child welfare or foster care cases, including but not limited of homelessness children. Here we have 5.1.5.1, the definition of income for purposes of eligibility. For the purpose of eligibility determination, tribal lead agencies have flexibility in defining income. This flexibility allows for exclusion or deduction of certain types of income from calculation of total family incomes. You will describe how your lead agency defines income for the purpose of eligibility in this section. Tribal lead agencies may deduct or exclude some type of income when determining eligibility. Common exclusions include federal or state tax credits, incomes from scholarship, grants or loans, or income from Alaska Native Corporation dividends, or tribal per capita income, government benefits such as TANF, Social Security, or supplemental assistance program, in-kind income, child support payments, and non-recurring lump sum benefits. Another common deduction is work deduction, which could be a flat dollar amount deducted from the net or gross income. Tribal lead agencies can also exclude income from certain family members. Common exclusion can also include income from children younger than 18, minor parents or their parents, and foster parents and subsidized guardians. In addition to the flexibility to deduct all of the income sources that the tribal lead agency chooses, they can also deduct portions of the income. So example, the lead agency may deduct $1,000 from their per capita payment. Here we have 5.1.5.2 establishing CCDF family income eligibility limits. Families must also have an income that does not exceed 85% of the grantee's median income. Through some tribal lead agencies may choose to set their initial income threshold at a lower amount. Let's go to the next slide for visual explanation of your options. Grantee median income. When talking about child care subsidy administration, you'll often hear the term state median income, tribal median income, and grantee median income. State median income refers to the estimated state median income for families by state for the current fiscal year for a family size. Tribes that have flexibility define the median income for family of the same size residing in the area served by the tribal lead agency, and this is referred to as the tribal median income. So when to decide which income you will use for eligibility, whether it's state or tribal, this is now becomes your grantee median income. We have previously posted the link for you to access the state median income and the federal poverty guideline charts for each state, which has the median income for different family size listed. If you've chosen to use tribal median income, you can use any source deemed valid and reliable. So here in sections 5.1.5.2, you will identify which source you will use as your grantee median income, the source of the information, the year information was gathered, and the state if using state median income. Tribal lead agency must establish CCDF income eligibility levels based on the grantee's median income. You will need to list what your current GMI is for each family size and then calculate 85% of the GMI for each family size. By law, this is the maximum allowable income for CCDF eligibility. If you choose to set your income eligibility level below this level, you'll need to indicate this when responding to this question. And you'll need to establish a graduated phase out for families who, at the time of eligibility redetermination, meet all non-income related eligibility criteria. And whose income is above the initial income eligibility limit, but still or below 85% of the GMI. So providing a graduated phase out promotes continuity by allowing for wage growth and tapered transitions out of the child care subsidy program, and supports long-term financial stability to help families to get to the point where they no longer need the subsidy. Sudden withdrawals of support can destabilize and undermine a family's pathway to financial stability. So 5.1.6 letter C is only relevant if you decided to have an initial eligibility threshold that is less than 85% of the grantee's median income. So here in 5.1.5.3, we'll talk a little bit about the tribal CCDF income eligibility levels table. All tribal lead agencies will complete columns A and B in table 5.1.5.3. Column B will automatically calculate. Column A requires you to list 100% of the current grantee's median income for each family size. And column B requires you to list 85% of the current GMI for each family size. So by law, this is the maximum allowed income for CCDF eligibility. If your tribal lead agency chooses to set income limits below 85% of the current grantee's median income, you'll complete columns A, C, and E in table 5.1.5.3. Column B and D and F will automatically calculate. As we shared earlier, you can access the state median income levels and the federal poverty guideline charts online on the Plan Preprint virtual homepage. Each year, tribal grantees will receive the chart from the regional office for state with the updated fiscal year state median income levels and the federal poverty guidelines to assist you with updating your grantee median income and your sliding fee scales. We are going to use the state median income percentages chart for Wisconsin, for example, on how to fill out columns A and B in the table here on 5.1.5.3. So let's take a minute and walk through it. First, locate 100% of your state median income for a family size of 1 and add that to column A. Then locate 85% of the state median income for a family size of 1 here, and then add that to column B. You will complete these 2 steps for each family size. So for a family of 6, you will find 100% of the state median income here and 85% of the state median income here. And that will add that to columns A and B. Awesome, thank you. If you're using tribal median income, TMI, to fill out this chart and need assistance, please reach out to your regional office for support. Or again, you're welcome to attend our writing cafe on Friday and ask for assistance. Okay, we'll go ahead and move on to, if you choose to set your income eligibility level below 85% of your GMI, you will need to indicate this when responding to this question, and you will need to establish a graduated phase out. You can use the SMI chart if you're using the state median income as your grantee median income. So for example, if you use 75% of your grantee median income as your maximum income level, you can locate the numbers for each family size by clicking here. There you go. Then you'll find a dollar amount for a family size of 1 here. And then to find the maximum phase out income level, if you're using 85% of the grantee's median income, look in this column here. And finally, you can find the 85% of the grantee's median income for a family size of 4 by clicking here. Awesome. And then we hope this activity was very helpful by seeing it visually. Remember, again, if you need assistance, you can attend the virtual writing cafe and then request TA support to get this part of your plan information done. Hopefully that was very helpful to see that visually. Again, if you have any questions, drop them in the chat box. If not, you're more than welcome to speak over the line and ask us if there are any questions you might have. All right, not hearing any, so we'll just move right along. We're going to move to 5.1.5.4. Income fluctuations in determining or redetermining eligibility. During the eligibility determination or the redetermination process, lead agencies must consider fluctuations in family income. This is particularly important to families who rely on work that is unpredictable or seasonal in nature, such as agricultural, construction work, or subsistence activities, such as hunting and fishing. You'll need to determine how the lead agency takes income fluctuations into account when determining and redetermining eligibility. Let's move over to family assets. Tribal aid agencies are required to ensure that children receiving CCDF programs do not have family assets that exceed $1 million, as certified by a family member. Tribal aid agencies can meet this requirements through family self-certification, either in the application, during the interview process, or through another method as determined by the tribal lead agency. Additional eligibility criteria. Tribal lead agencies have flexibility in establishing additional eligibility criteria. Additional criteria could include example as tribal applicants first applying with the state CCDF program or higher income limits in one part of the tribal service area. An additional eligibility criteria include different income eligibility limits, and then you'll need to attach additional income eligibility tables and indicate these attachments. All right, I will now turn over our next section over to Teresa.
Okay, thank you, Dee. We're now going to get into subsection 5.2. So let's discuss the application and eligibility determination and redetermination process in subsection 5.2 of the plan preprint. This section is for everyone, regardless of if you have chosen standard or categorical eligibility. Tribal lead agencies must inform families of eligible children and the general public of the process by which they can apply for tribal CCDF assistance and the process and timeframe for eligibility determination and redetermination. Documenting this procedure within your tribal lead agency's policies and procedures will ensure that the process is replicated for all families, documents are collected consistently, and information is available if the program is audited through your tribe's auditing process. Using your internal policies and procedures, you will complete this section. You will check only the boxes that apply. If you check the other boxes, you will provide a description of your processes. So let's pause here for a quick minute and see if anybody has any additional questions as we move on in this next subsection. Okay, I think we will just move ahead into 5.2.5, which is your 12-month eligibility. So tribal lead agencies are required to establish minimum 12-month eligibility and redetermination period, regardless of changes in a family's eligibility, including changes in the child's age, including turning 13 years old during the 12-month eligibility period, and changes in the family's residency within a tribal service area. The CCDF final rule established a minimum 12-month eligibility period for families receiving child care services through CCDF. Tribal lead agencies must ensure that families receiving CCDF will be considered eligible and will receive assistance for at least 12 months during their eligibility redetermination, or before that redetermination. Tribal lead agencies have the flexibility to have eligibility periods that are longer than 12 months. Parents are welcome to end their authorization for child care services at any point. The 12-month eligibility period is regardless of temporary changes in parents' work or activities, and regardless of changes in family income, as long as the income does not exceed 85% of GMI. Tribal lead agencies implementing categorical eligibility are not required to discontinue services if income goes above 85% GMI. Tribal lead agencies are prohibited from allowing shorter eligibility periods within the minimum 12-month eligibility period. 12 months is the minimum period of eligibility. You may determine a longer period would better fit your community and identify that determination within your tribal CCDF plan. For example, if you have an early Head Start child care partnership and a child is eligible for early Head Start for 24 months, you could determine that CCDF eligibility period would be 24 months to align services better and lessen the burden for families' redetermination. In section 5.2.5.2, you will describe your policies and procedures in implementing the 12-month eligibility and redetermination requirements. Once families are determined eligible for CCDF services, they remain eligible for the remainder of the minimum 12-month eligibility period, regardless of temporary changes in work, education, or job training activities. The final rule defines specific circumstances that qualify as temporary changes that cannot have an impact on eligibility. These circumstances include the following: time-limited absences from work or school due to reasons such as the need to care for a family member, including family leave and including parental leave or an illness. Interruption in work for a seasonal worker, any student holiday or break for a parent in training or education, reductions in work, education, or job training hours, as long as the parent is still working or attending training or education, any other cessation of work or attendance at a training or education program that does not exceed 3 months, or a longer period of time established by the tribal lead agency. A change in the child's age, including turning 13 during the eligibility period, and or a change in residency within the service area. Tribal lead agencies must consider all changes on this list to be temporary and not prohibited from terminating eligibility in these instances. Tribal lead agencies may consider additional changes to be temporary as long as those changes are defined in their CCDF plan under other. Here's an example of a temporary change. A family is authorized for care at the beginning of the year, and then the mother goes on maternity leave in March. Even though the mother is not currently working, the family retains eligibility and the copayment is reduced due to the mother not working. The mother returns to work in August, and the copayment is adjusted due to the additional family member and the current income. By policy, this family continues within the original 12-month eligibility period. In December, the family completes the 12-month eligibility period and follows the tribal lead agency's redetermination process. A tribal lead agency has the option to discontinue assistance during the 12-month eligibility period due to a parent's non-temporary loss of work or cessation of attendance at a job training or an education program. However, it must provide at least 3 months of continued assistance at the same level after such loss or interruption. At the end of the minimum 3-month period of continued assistance, if the parent has engaged in a quality work, training, or educational program activity with an income below 85% of SMI, assistance cannot be terminated, and the child must continue receiving assistance until the next scheduled redetermination or at the tribal lead agency's option for an additional minimum 12-month eligibility period. Does the tribal lead agency choose to discontinue assistance during the minimum 12-month eligibility period due to a parent's non-temporary loss or interruption of eligible activity? If the tribal lead agency chooses this option, they must allow continued child care assistance for a reasonable period, not less than 3 months. After this period, the tribal lead agency can elect to discontinue assistance. Further, during this job search period, the grantee does not need to collect additional documentation, as this creates an additional burden for the family. This way, the parent can continue to receive assistance while looking for a new job or resuming training or education. Otherwise, the lead agency may not terminate assistance based on the non-temporary change in work or activities prior to the end of the 12-month redetermination period. At the end of the 3-month job search period, the family is engaged in a qualifying activity. The grantee has the option of resuming their eligibility to end at the initial 12-month mark, or the family can restart their eligibility determination period. There are a few reasons why a tribal lead agency could choose to discontinue child care services to a family prior to the next 12-month redetermination in the following limited circumstances. The first is excessive, unexplained absences. The tribal lead agency would need to set a threshold of what that they consider to be excessive absences in their policies and procedures, and would need to make every effort to contact the family before discontinuing assistance. Choosing this option does not change the tribal lead agency's reporting requirement, and the tribal lead agency cannot require additional reporting of a family with frequent or unexcused absences. The second reason that a tribal lead agency could choose to discontinue assistance for a family would be if they move outside of the tribal service area. Tribal lead agencies can choose to continue to provide services in this situation and coordinate with other local, tribal, and state CCDF programs to transition the family. The last reason why a tribal lead agency might discontinue child care assistance for a family could be if the family is found to have committed substantiated fraud or intentional program violations, which would be defined by the tribal lead agency and would be made clear in the tribal lead agency's policies and procedures. Families are required to report to the tribal lead agency at any time during the 12-month eligibility period if the family's income exceeds 85% of the GMI, taking into account irregular fluctuations in income. Any additional reporting requirements during the 12-month eligibility period must be limited to items that impact a family's eligibility. For example, the impact the tribal lead agency's ability to contact the family or pay the child care providers, and shall require an office visit. In addition, the tribal lead agency must offer a range of notification options to accommodate families. Tribal lead agencies are required to have procedures and policies in place to ensure that families, especially families receiving assistance under the TANF program, are not required to unduly disrupt their employment, education, or job training activities to comply with the tribal lead agencies or designated local entities' requirements for the redetermination of eligibility for assistance. Will you require families to report other changes, such as a change of address, a change in need for child care, or change in child care provider? If so, you will need to describe it in section 5.2.7.1. Reporting should not be burdensome. You will describe in section 5.2.7.2 how you ensure reporting changes are not burdensome and avoid impact on continued eligibility between redetermination. For example, reporting changes by mail, email, online forms, or in-person or extended submission hours. You will need to describe the tribal lead agency's procedures for meeting the parental access requirements. Many times, tribal lead agencies add this clause to their provider agreements to ensure access. The TANF agency, not the tribal CCDF lead agency, is responsible for establishing the following criteria or definitions. These criteria or definitions are offered in this plan as a matter of public record. The question is for informational purposes. The tribal lead agency may also choose to coordinate with either the tribal TANF agency or agencies within the service area, the state TANF agency, or both. The definitions provided should be gathered from the TANF agency that is most relevant and works more closely with the tribal lead agency. Tribal lead agencies are required to inform parents who receive TANF benefits about the exception to the individual penalties associated with the work requirement for any single custodial parent who has a demonstrated inability to obtain needed childcare for a child younger than age 6. To complete sections 5.2.9.1 through 5.2.9.3, reach out to your local TANF agency or look up the information online on their website. So let's pause here for a quick moment to see if we have anyone that has any questions on the information that we just covered. You can put your questions in the chat box at any time. Also, as we've been letting you know, we do have those writing cafes available to you on Friday. Okay, let's go ahead and move into subsection 5.3, where we will now cover improving access for vulnerable children and families. CCDF requires tribal lead agencies to prioritize child care assistance to children with special needs and families experiencing homelessness. The tribal lead agency may define these groups and others as a higher priority than other children and families. You can choose to guarantee subsidy eligibility or serve these families first when funding is limited, and if you implement a waiting list or program closure. You may specify other policies for priority groups, such as differential rates or quality funds for providers. You can have the option to place these children in high priority groups for eligibility, exempting them from waiting lists and waiving income and work requirements. Tribal lead agencies must provide their definition of children with special needs and describe how they give priority to these children. Definitions may include the following: children with physical or mental disabilities, children who are considered part of vulnerable populations, such as children in the child welfare system or children of teen parents. The McKinney-Vento Act defines children experiencing homelessness as those who lack a fixed, regular, and adequate nighttime residence and who are sharing the housing of others due to a housing, economic hardship, or similar reason, living in hotels, motels, trailer parks, or campgrounds due to the lack of alternative adequate accommodations, living in emergency or transitional shelters, abandoned in hospitals, living in a primary nighttime residence that is public or not designed for human beings, living in cars, parks, public spaces, abandoned buildings, substandard housing, bus or train stations or similar settings, or migrant children. Tribal lead agencies are required to do the following for children experiencing homelessness: permit the enrollment of children by establishing grace periods for children to receive assistance while their families are gathering documentation. Provide training and technical assistance to child care providers and the appropriate tribal lead agency or designated entity staff in identifying and serving children experiencing homelessness. Conduct specific outreach to families experiencing homelessness. You will also need to define how you improve access to childcare for children experiencing homelessness in 5.3.2.1. Some examples include modify provisions to remove barriers and expand eligibility, collaborate with other agencies to facilitate support for children experiencing homelessness, provide staff training to increase awareness to improve identification and engagement practices, utilize grants and contracts to provide and improve the quality of childcare. Tribal lead agencies will need to indicate how services are prioritized for children experiencing homelessness. These could include any of the following: prioritize enrollment in childcare services, serve without placing on a waiting list, waive copays on a case-by-case basis, pay a higher rate for access to higher quality care, using contracts or grants to reserve spots. You will check all boxes that apply in this section. You will also need to describe how the tribal lead agency conducts outreach to children experiencing homelessness and their families. Tribal lead agencies must establish a grace period that allows children experiencing homelessness and children in foster care to receive CCDF assistance while providing their families with a reasonable time to take any necessary actions to comply with immunization and other health and safety requirements. The length of such a grace period shall be established in consultation with the state, territorial, or tribal health agencies. In this section, you will describe the grace period and how the length of the grace period was established in consultation with the state or tribal health agencies for both children experiencing homelessness and children in foster care. In 5.3.3.1, you will need to identify if they have any additional priority rules or categories. If you have any additional priority rules, you will need to define those. The CDCDF final rule offers lead agencies flexibility to determine the best strategies to build the necessary supply of high quality childcare that meets the needs of children and families in their communities. Lead agencies should, 1, identify supply shortages based on information gathered, 2, select the most appropriate strategies to build the supply of high quality care, and 3, monitor supply building through ongoing evaluation to assess progress towards goals. Lead agencies should consider the availability of high quality childcare in all localities within their service area, across all categories of care, such as center-based care or family child care, for all ages of children, and for special populations of children. For example, children, again, experiencing homelessness, and children with special needs, and children in need of non-traditional hour care or dual language learners. For more information, you can see the resource listed in the plan preprint for more information. Strategies to build and sustain the supply of quality care listed in the information memorandum reference on the slide include provider payment rates for support that support quality care, financial incentives, direct contracts and grants, investing in community hubs, expanding high quality family child care, expanding the supply of highly qualified teachers and caregivers, early Head Start child care partnerships, public and private partnerships, child care facilities, technical assistance on business practices, rural child care, technical assistance on early learning guidelines. And in selecting strategies for supply building, it's important to consider immediate and long-term strategies. Tribal lead agencies should incorporate strategies that allow for expanding the supply of high quality care and sustaining quality over time. If you would like more information for any of the supply building strategies, please reach out to your TA specialist. I will now pass it over back to Nazba.
All right, thank you for all that information, Teresa.
Thank
So
you.
we've now reached 5.4. Families are required to contribute to the cost of care through a copayment. Tribal lead agencies have flexibility in determining a family's contribution to payment, which we will talk more about in this section. Tribal lead agencies, including those that have chosen categorical eligibility, must establish and periodically revise a sliding fee scale that varies based on income and the size of the family to determine each family's contribution or copayment that is not a barrier to families receiving CCDF program funds. In addition to the income and size of the family, the tribal lead agency may use other factors when determining family contributions or copayments. So tribal lead agencies cannot use the cost of care or amount of a subsidy payment in determining copayments. In the CCDF plan, tribal lead agencies must provide additional information, including a copy of the sliding fee scale, the effective date of the sliding fee scale, whether the scale is for the entire service area, and attach any other sliding fee scales used if you have different scales for different areas of your service area. The fiscal year 2023 through 2025 Tribal CCDF Plan Preprint has been updated to include this table in section 5.4.1.1. And so you will use your sliding fee scale to answer the questions on the slide. So the questions there are the lowest income level where a family is charged a copayment. What is the monthly copayment for a family based on the lowest income level? What percentage of income is this copayment at the lowest level? Lowest income level, highest income level before a family is no longer eligible. What is the monthly copayment for a family at the highest income level? What is the percentage of income at the highest income level? And so you will answer these questions in each row with the family sizes from 1 through 5 using your sliding fee scale. And we are going to share some examples of how to fill this section out after we provide a little bit more information on sliding fee scales and family contribution to copayment. So how will the family's contribution be calculated and to whom will it be applied? Tribal lead agencies have flexibility when it comes to determining a family's contribution to payment. A few of them are on the screen, so please take a second to think about the copayment considerations that you'll need to describe to answer these questions. In section 5.4.1.4, you will check only the boxes that apply to how you determine the calculation of family contribution. On the screen, we'd like to highlight the federal fiscal year 2022 federal poverty guidelines percentages resource. You can access the state median income and federal poverty guidelines resources for your states on the Plan Preprint virtual training homepage. And again, we will share the link in the chat to where you can get this resource. So this chart can be used to develop your sliding fee scale if you choose to base it on federal poverty guidelines. For example, if you are using the state median income as your grantee median income and want to waive copayments for all families whose income is below the federal poverty guidelines, you could use this chart to identify what that income is for a family size and enter into your sliding fee scale. Also, it's important for you to update your sliding fee scale annually because the federal poverty guidelines change yearly. At the beginning of each year, you will receive an updated chart from your regional office for your state to assist you with your making your updates. And so we will put the link to the resource in the chat box for the where you can find federal poverty guidelines. So using the federal poverty guideline resource to develop a sliding fee scale, let's look at how the federal poverty guidelines or FPG could be used to develop your sliding fee scale. So reference the family size here as you start accessing your data. And then to begin, you will need to find the monthly income for 100% of poverty to enter, and you can find 100% of the poverty here for each family size. And next, you will need to find the monthly income for 125% of poverty to enter into the next row, and you can find 125% of poverty here. For 160% of poverty, you will need to complete the calculation here. Take 100% of poverty and multiply it by 160, and you will get the number you are looking for. For example, 100% of poverty for a family size of 4 is $2,313. Multiplying it by 160% equals $3,700. To get 185% of poverty, you will complete the same type of calculation, only replacing 160% with 185%. The final monthly income you will need is 85% of the state median income, and you can find it here in the yellow highlighted row for each family size if you are using the state median income as your grantee median income. You will replace these numbers if you are using your tribal median income as your grantee median income with your tribal income information. So as we mentioned earlier, in the new plan, it's been updated to include this table in section 5.4.1.1, where you will use your sliding fee scale to answer these questions on the slide. And so let's walk through this process quickly using the sample sliding fee scale that we have on the slide. So first, look at the lowest income level, which is $1,416, which is found here. And you wouldn't use the row above because the copayment is $0. Next, find the monthly copayment for a family based on the lowest income level. In this example, it would be $20, and you can find that here. Then, since this is a fee-based sliding fee scale, you will have to complete some calculations to find the percentage of income this copayment is at the lowest income level. To find this, you're going to take the $20 and divide it by the $1,460 monthly income, and it will determine that the $20 is 1.4% of the family's monthly income here. The next step is to locate the highest level of income before a family is no longer eligible. So you'll find 85% of the grantee median income here. And then to find what the monthly copayment would be for a family at the highest level of income, you will look here. And finally, to answer the question of what the percentage of income is, the copayment at the highest income level, you will again calculate by taking the $80 copayment and dividing it by $3,672 to get the 2.2% found here. So let's go to the next slide for another example. Here is another example using state median income percentage-based sliding fee scale. So first, look for the lowest income level, which is $1,134, which is found here. And again, you wouldn't use the row above because that copayment is $0. Next, find the monthly copayment for a family based on the lowest income level. In this example, it would be $19, which you can find here. Then, since this is a percentage-based sliding fee scale, you will find the percentage of income here. The next step is to locate the highest level of income before a family is no longer eligible. You will find 85% of the grantee median income here. Then, to find what the monthly copayment would be for a family at the highest level of income, you will look here. And finally, to answer the question, what the percentage of income is the copayment at the highest income level, you will look here. And so you will need to do the same process for each family size up to a family size of 5 in the plan. And I know we kind of went through these examples quickly, but if you need assistance with filling this chart out, please attend the virtual writing cafe tomorrow or request TA through your regional office. So let's pause here for any questions. You can take yourself off of mute or add them to the chat box. And, oh, go ahead.
I have a question. Okay, so I like the addition that we're going to be doing, updating our sliding fee scales annually. But my question is about the not what you just showed us, but something that was a little bit before this. When we're doing our sliding fee scale, because you guys had mentioned something about kind of like that cliff effect thing, but y'all didn't call it a cliff effect, like a phase out thing.
Graduated phase out.
Yes, is that going to be taken into consideration? Where you showed the 75 and the 85, is that going to be incorporated as another component of our sliding fee scale?
So Meryl, do you want to answer that question, or would you like me to answer it?
Why don't you start and I can add anything?
Okay, so so I'm not sure who answered that. Who just asked the question? What's your name?
Oh, this is Carolyn.
Hi, Carolyn. Are you planning to add a so for your so for like, do you guys have standard eligibility? You would have that 85%, which is kind of like anybody over the 85% is over income for services. So what some tribes do is they don't use the 85% threshold. They might say, we're gonna have our threshold at 75%. And if you go lower than that 85% threshold, then you have to establish what's called graduated phase out. So that's only for tribes that choose to offer a lower threshold than 85% if you're using the standard eligibility option.
Okay.
Do you know if your tribe is planning to do that?
We haven't decided.
Okay.
We're considering like maybe the right now we're tossing around and discussing whether we're going to do like a standard, like a hybrid thing, a standard and a categorical thing.
Okay, so so generally what we talked about earlier, so generally like with people who use standard, you have to follow that, you know, there's that threshold of 85%. So if your income for families of different sizes exceeds that 85%, they're not going to be eligible for the CCDF subsidy. Now, some tribes, they might have a lower threshold. They might say that, like the example we gave. So if a tribal lead agency is like, we're going to have our threshold at 75%. So any of our families that exceed the 75%, like their monthly income is a greater than amount, that's where they're no longer going to be eligible. But if you choose that option, if you have a threshold lower than that 85% of your median income, you would have to establish what's called graduated phase out. And there's a little bit more steps that you would have to complete in your plan if you choose that.
Okay, I understand.
So,
Nazwa,
oh yes, go ahead.
hi, this is Shar. I just wanted to add a little bit more information. So some people, when you're talking about the cliff effect, Carolyn, I think you're thinking about as people kind of reach a higher income level as they move towards ineligibility. A lot of times grantees will use a higher percentage co-payment so that once a family is no longer eligible, it's not such a burden to them to have to pay the full cost of care. So you can do that as you're establishing your sliding fee scale. You would just maybe use a higher percentage at a higher income level. So I think that's what you were talking about.
Yeah, I was just trying to figure out that she's talking about the sliding fee scale. And then you guys had talked about that 75% and the 85%. And I was just confused about when you would, if everyone was required to do that, that lower threshold thing. Like I just took it as when you guys were talking about it, that we would have to establish that. But now I understand that it's only if we choose a lower threshold level.
I think it's probably a good idea just to request some time with your regional office and TA to kind of talk through your sliding fee scale, just to kind of think about the big picture and what's going to best fit your community's needs, as well as once you start establishing a sliding fee scale for categorical eligibility, that could look a little bit different. So I highly recommend looking at the tips and considerations document for sliding fee scales. There is an example of a sliding fee scale for categorical eligibility in there, to kind of help prepare for possible TA conversation.
Okay, thank you.
All right, thank you for that, Shar. So we will move on. All right, so the tribal lead agency must ensure that family contributions or copayments is affordable and not a barrier to families receiving CCDF program funds. You will check only those that apply and describe them. So your options are: limit the maximum copayment per family to a dollar amount, limit the combined amount of the copayment for all children to a percentage of the family income, maximize the abrupt termination of assistance before a family can afford the full cost of care, otherwise known as the cliff effect, and other. The tribal lead agency may waive contributions or copayments from families whose income are at or below the poverty level for a family of the same size, for families who are receiving or needing to receive protective services as determined for purposes of CCDF eligibility, or for families who meet other criteria established by the tribal lead agency. It's also possible to waive copayments for all families across the board if you're using the SRSA funds, but be sure to check with your regional office to discuss that further. And so some questions to consider: will you waive your family contributions to copayments? And if you do, you're going to check in this section, you're going to check only those that apply. So your options are: yes, the tribal lead agency waives family contributions or copayments for families with an income at or below poverty level for families of the same size. Yes, the tribal lead agency waives family contribution to copayments for families who are receiving or needing to receive protective services as determined by the tribal lead agency for purposes of CCDF eligibility. Or yes, the tribal lead agency waives family contributions and copayments for other criteria established by the tribal lead agency. So some examples could be for families experiencing homelessness, migrant workers, victims of human trafficking, families receiving TANF. But whatever you decide, you're going to describe the criteria in this option. And last, there's another option where you could select no, the tribal lead agency does not waive family contributions or copayments. And so will your tribal lead agency allow providers to charge families additional amounts above the required copayments in instances where the provider's price exceeds the subsidy payment? In section 5.4.8.1, you will indicate no or yes. And if you select yes, you would describe your policy and procedure. So on the screen, we want to highlight the determining the family contributions to payment tips and considerations. This is for tribes with medium and large allocation sizes, and we'll share the link to this resource in the chat box. This is the resource that Shar had just mentioned a few minutes ago. So we'll just pause here to see if any questions. If there's any questions, anything we covered so far. Okay, I don't see anything in the chat box, so I guess we'll move on. And so we want to highlight another resource, and this is the American Indian and Alaska Native Child Care and Development Fund Guide to Subsidy Administration for Medium and Large Allocation Grantees. And this guide provides an overview of child care and developmental fund subsidy administration. This guide explores key aspects of CCDF subsidy administration, such as defining which families are eligible to receive CCDF subsidies, establishing and overseeing processes for eligibility determination and redetermination, establishing payment rates for providers and co-payment rates for families, and implementing provider payment practices. And so we'll share this link in the chat box. I highly recommend that you print this out and keep this on your desk. It's a really awesome resource to refer to. To ensure you have all the information you need as you complete Section 5 of your Tribal CCDF plan, we have a resource directory that highlights some key references, resources, and policy guidance that may assist you with completing this section of the plan. So you can access it on our TCBC website, and we will share the link in the chat box to this resource directory. As we close the section of the fiscal year 2023 through 2025 Tribal CCDF Plan Preprint training, we offer one last suggestion that you reflect on any questions that you may still have, questions you'd like to bring back to your leadership and your team, any strategies you want to employ for moving forward, and finally, next steps and technical assistance needs. Please feel free to reach out to us if we can assist with any of these reflections. And we just want to thank you for your time. We appreciate your feedback on the presentation. We would appreciate your feedback if you could take a minute to complete our survey. It will help us to know what we can do to deliver this information in a manner that works for all the participants. So we'll share the survey link in the chat. So if you have time, please fill that feedback survey out for us. And tomorrow we'll hold a regional meeting and greet and a writing cafe, and we'll drop the link to the registration link in the chat in case you haven't registered. Again, that's the registration for the writing cafe and the meet and greet that's going to happen tomorrow. Thank you so much for joining our session today. And again, if you would like additional technical assistance, please reach out to your regional office and request a TA. Thank you, and we'll see you shortly for section 6.